In this study, we examined prescription opioid use in Australian women of reproductive age and the implications for unplanned pregnancies. Consistent with international trends, annual dispensing of prescribed opioids has increased in Australia over the past 2 decades. Studies have linked prescription opioid use in pregnancy with increased risks for the mother and fetus, including adverse perinatal outcomes and congenital malformations in infants. As around half of all pregnancies are unplanned, prescription opioid use among women of reproductive age may result in exposure in unplanned pregnancies. Thus, an understanding of prescription opioid use among women of reproductive age is important. Using pharmaceutical dispensing claims for a 10% random sample of Australians, we examined the proportion of Australian women aged 15 to 44 years that use and initiate prescription opioid analgesics. We also estimated the number of calendar months each year that women were dispensed prescription opioids. We found that around 1 in 8 women use opioids and over 1 in 10 women initiate opioids each year. The proportion of opioid use decreased by 11.7%, while the proportion of women initiating opioids decreased by 19.4%, and this was primarily driven by a decrease in the use of codeine combination products. Codeine combination products followed by oxycodone and tramadol were the most commonly used opioids. We also found stark differences in the proportion of opioid use by age group. Women aged 15 to 19 years who have the lowest birth rates in Australia had consistently the lowest proportion of opioid use, while women aged 30 to 34 years with the highest birth rates had a high proportion of opioid use. Among women dispensed opioids, around 73% of women received an opioid in only 1 month a year. This suggests that although 1 in 8 women still use opioids, the majority of opioid use is short-term, and this minimizes the risk of exposure overlapping with an unplanned pregnancy. These findings highlight the importance of appropriate prescribing and effective contraception when opioids are used among women who might become pregnant. Thank you, and I'd like to acknowledge Services Australia for providing the data.